So we're gonna try our HVLA technique one more time. We're gonna side bend towards, rotate away, and then there we go. Sometimes it might take a couple of thrusts, but eventually you'll be able to get it. And if you don't, you can sometimes go to the opposite side and see if that's well. Hi, this is Dr. Yousef. We're doing a osteopathic treatment on this patient. She's had some cervical neck pain, and she's been having some left-sided radiation of that pain. So what we're going to do is, I always start with the cervical spine, and what I would like to do is kind of release the neck by doing a suboccipital release. So what that involves is I will take my hand and I will cup it and be simultaneously pulling on the back of the neck, gently giving her some traction. Ideally, this will help release some of the tissue around the neck, as well as give me an opportunity to do more advanced treatments such as HVLA. And the patient had gone to a chiropractor, and they had performed HVLA, which is the high velocity, low amplitude procedure. And that's typically what you see with a lot of chiropractors. They'll do the adjustment, and you'll hear the crack and pop. But the patient was a little bit unsatisfied with that because she didn't expect that many adjustments. And if you really listen to what I do and what we do here, you'll hopefully just get one or two adjusted. It should not be a full all the way body adjustment, which I'm not in favor of, but again, for some people that might be the way to go. In addition to the suboccipital release, so once I feel like there's been some effect, sometimes I'd like to do some soft, this is basically some soft tissue release of the paraspinal muscles. So in the cervical spine, you can release some of this tissue by doing kind of a gentle massage, but essentially what you're doing is loosening up the tissue so that when you do get that adjustment, you can get more fruitful results. In addition, we were talking to some of our staff and students, and we have kind of advanced some of our craniosacral work. So right now I'm just going to do a little craniosacral technique for her. This is to help improve the cranial rhythmic impulse. And this has a little bit more of an advanced treatment. And the reason for that advanced procedure is that so that we can allow for that impulse, the feeling of fluid slash warmth to the base of the neck. And when I feel that, I sort of either enhance it or I block it. And what I do by blocking is I kind of hold it in place for a short period of time, put a little pressure, and I kind of describe it as like a floodgate. While I put the pressure on, then I release it, and then the fluid, slowly comes back, which allows for basically better circulation to the area. So for my last procedure I'm going to do is a HVLA, which is a high velocity, low amplitude procedure for the cervical spine. In this case, I noticed significant tissue texture changes and asymmetry in her left side. So I'm going to palpate that, side bend, rotate away, and then not get it. Oftentimes, yeah.